we'll call the meeting to order. I already recognized the quorum. The first item is the approval of the October 5th, 2020 minutes. And I will move them. Frank Trotta will second them. Any council members have any revisions, changes, objections, or abstentions? Hearing none, those minutes are approved. Thank you. My chair's report, two items I want to highlight. One, just a perspective from the Long Island control room. As you know, the governor put me on the control room with both county executives and Tracy Edwards and John Durso, head of the NAACP and the Long Island Federation of Labor. We meet every day and have been meeting every day since April. And most of you, this won't come as a surprise, especially Carol and the folks, Ken working over at the hospital, and all the ones dealing with the students who are not there. The numbers on Long Island are getting really bad. Give you some perspective, in September and October, we were averaging under 100 new cases a day. And Nassau and Suffolk County for the past 5 days have been averaging close to, and some days exceeding 2,000 cases a day. And our hospitalization rates are significantly increasing, not just at Stony Brook, but all the other hospitals on Long Island. And the death rates, unfortunately, are going up. In fact, Long Island, the numbers are as bad on Long Island as anywhere in the state. And unfortunately, we have some of the highest categories of any region. And so things are bad. They're going to continue to get bad, especially over the next few weeks into the holidays. Hanukkah starts on Friday and Christmas is 3 weeks away. Things will likely continue to get bad. We still haven't seen the Thanksgiving bump. We're beginning to see some of that, but we'll see more of that probably later this week and into next week. And then the holidays, likely things will get worse. So, and January is probably not going to be a fun month either. So things are definitely, all the arrows are heading in the wrong direction this time. And from June, July, August, September, and October, all the arrows were heading in a good direction. But that's not been the case from the middle of November to where we are today. So that is concerning. It's concerning to all the businesses out here. It's concerning to all the residents out here, and certainly should be of concern to everybody at Stony Brook and all the colleges on Long Island. I think the governor is doing the best he can, and his team, and he has the right approach, trying not to shut down the whole state again, and doing this micro cluster category, where looking at these statistics that I just mentioned, hospitalization, infection rates, and death rates by community, as opposed to an entire county or region. And, so far, we have, 4 communities that have been identified in this yellow zone, which is the first level of alert. 2 in Suffolk, Riverhead and Hampton Bays. And then there are 2 in Nassau, Great Neck and Massapequa Park. I wouldn't be surprised if this week we see several more communities in both counties join that new zone. Just based on the trends. So those things are concerning, and we just need, again, preaching to the choir here, and just need to continue to do what we've been doing, being smart. Masks work, distancing works, washing hands works, and remote learning is working. And remote work is working. I know I remotely work, 2 days a week and go into the office 3 days a week. And that's working for a lot of people too. So we can't let our guard down now. And the good news is, I know we all know this, is that hope is on the way. I think we all do see the tunnel, the light at the end of the tunnel. Unfortunately, it's not going to come in January, December. But I think late spring and into the summer, and certainly by next fall, I think we're going to be in a much better place. So we just got to get through the next couple of months, which are going to be tough. And that's a perspective from the control room. And the only other thing I wanted to mention, I've shared this with Maury and Judy. I think it's important for us to reflect on some of the results from Election Day, not from a partisan perspective. I'm excited about the new occupant in the White House in terms of science-based commitment to research and commitment to funding research. I think that's going to be great for Stony Brook. But more of my, not concerns, but observations are really in Albany. I think Stony Brook, the campus, all parts of the campus, had a very comfortable feeling, knowing that for the last 30 plus years, we had Ken Laval and John Flanagan as two go-to people to help us with so many different issues. And that was a strategy that worked well. But as we both know, John has already left and Ken Laval is leaving in a couple of weeks. And so our efforts in Albany need to take on a different approach. I know Judy and the team started that last year with folks like Senator Todd Kaminsky and Senator Jim Gorin, and they're going to need to continue. And so, in terms of our Albany efforts to seek help from Albany, we all need to be cognizant of the changes. The two new senators replacing John and Ken, I'm friends with both of them. Anthony Palumbo from Southold is replacing Ken Laval, and Mario Matera, a fellow St. James resident like myself, known him for years. Both nice guys, good guys, but they'll both be in the minority party. And we know how Albany works. Majorities tend to be better for the particular institutions in their districts. And so Mario and Anthony are going to have, a lot of heavy lifting to do, but we're going to need relationships on the other side too. So no longer will we really be relying on Ken Laval and John. And I think that is a huge change. It's something that Stony Brook had relied on for decades. No longer will work. And we just need to be, we need to observe that. So that's it really in terms of things I wanted to mention from my chair's report. Now I'm going to hand it over to Dr. Maureen McGinnis for her president's report. Thank you.
Well, good morning, everyone. So glad to see you all again. I want to begin really by picking up on what Kevin was talking about related to case counts and to tell you about Stony Brook Hospital's planning for this, because of course that I know is on everybody's mind. So we watch very closely the number of patients that we have, not only at Stony Brook University Hospital, but also in Southampton and Eastern Long Island, just to give you a sense of the change in magnitude over most of the summer when we were, as a county, running at about a 1% positivity rate in terms of tests returning positive. We also had a census at the university hospital that kind of hovered between about 5 and 10 patients. As of this morning, we have 76 patients, of whom 4 are in the ICU and 2 are on ventilators. So that just gives you a sense of the scale of the magnitude of change, as does a positivity rate, the last time I looked at it, for Suffolk County that was now at about 6%. So everything that Kevin was saying is enormously important. And I would add to that, when Dr. Deborah Birx visited Stony Brook earlier this semester, she very rightly predicted that this is indeed what would happen as we all turned more indoors as the weather got colder. But she also made another really important point that, just as you get a chance to talk with friends and colleagues, is that what we were seeing is the virus being transmitted among families and friend groups. people who would get together and say, hey, come over to my house and, let's watch the football game, assuming because you're my friend, you therefore couldn't possibly have it, or you're a member of my extended family. And so she was enormously nervous about Thanksgiving. I think we are starting to see that, and I think the case counts will continue to rise. And so that is also, I think, something we should all take to heart about the upcoming winter holidays as well. I know it's enormously difficult for all of us not to gather with friends and family in this time when we're so used to being together, but I do think that that is enormously important. Dr. Kashansky and Carol Gomes, who's head of our hospital, have been working on surge plans for many months. And certainly they are needing to begin to put those in place. So they are gearing up with changes of assignments for many of our staff. They have been expanding emergency medical privileges for attending physicians to ensure that we have the coverage that they need, which allows some physicians to act outside the scope of their normal licensures in accordance with executive orders. And this, of course, was necessary last spring, and we've just enacted it again so that we will be ready if case counts continue to rise. We have reopened the ambulatory care pavilion for triage space in order to accommodate all those patients who have milder COVID symptoms, where we can rapidly test them and then make the appropriate disposition based on what we learn from that. This also eliminates our overcrowding, or the concern about overcrowding in the main emergency department, and allows us to better manage patient throughput and practice social distancing. We have 4 surge units that have opened to accommodate and cohort any of the COVID positive patients. And we have additional surge units ready should those be needed if case counts continue to rise. Our PPE supply remains stable as the hospital continues to meet the governor's mandate to maintain 90 days of PPE supplies. Staffing certainly could become a challenge, but the hospital has many different plans in place in order to address surge capacity. Our goal is to keep elective procedures and elective surgeries flowing as long as we have both enough staff and enough PPE to remain open. This is very different from in the spring when virtually all of those sort of elective, both surgeries and procedures were sort of shut down. And as long as we have the staff and the supply and regulators allow us to remain open, we know how to handle this now. Given the experience in the spring, there were just so many unknowns at that time, and we definitely know so much more now. We have had to reinstate the no visitation policy. There are categories of exceptions there, but we believe just for the safety of our community, that is the right thing to do. We're in an entirely different place with testing than we were in the spring, with a number of high throughput testing methods available at this point. And we are actively screening, doing surveillance testing on all our hospital faculty and staff. And of course, that is different from the spring as well. Vaccination administration planning is in process. We put in an application to serve as a COVID vaccination administration site, and that has been approved. An initial shipment of about 170,000 doses of the COVID-19 vaccine is expected to arrive in New York by the middle of the month. And the University Hospital will be coordinating resources for vaccine prioritization and administration. And we have certainly placed in all the orders we can for the maximum amount of doses allowable. But as you all know from your reading of national news, there is still so much for us to learn about how this is going to play out, when doses are really going to be available, and even indeed what the full prioritization list is going to look like. So that's the report from the hospital side. I do think it's important, though, that we take a moment to actually feel really good about the success of the fall semester. I don't even remember the last time we met, but there was certainly lots of concern in many different corners about the idea of bringing a large number of students back to campus and holding a certain number of in-person classes. But we had planned for months. We had worked very closely with our medical experts, and we had great plans in place. And it turns out that we not only executed them very well, very importantly, we had an amazing community of students who understood the relationship between their personal actions and the impact that would have on the community. And they were all very determined to be able to spend their entire semester on our campus, and they followed the guidelines. And it means that and we did surveillance testing, working our way up to surveillance testing the entire population weekly. In the spring, we will be testing them twice weekly. And in the entire semester, we had fewer than 100 students test positive for the virus. That is well below 1%. And that is amazing. It turns out that being on Stony Brook's campus was really one of the safest places you could be in Suffolk County. We continue to have a much lower positivity rate than does the remainder of the county. We continue testing those students who are still with us. And we continue testing our faculty and staff. And again, very, very low positivity rates. And so we feel very good about the way that we were able to handle the fall semester. This really is an extraordinary accomplishment of the 4 university centers. Well, let me back up and say many of you might have noticed that the governor had decided that any campus that achieved or had 100 positive cases in a 14-day period would go to all remote instruction. We are the only one of the 4 U centers that never got even close to that 100 mark in a 14-day period. Most of the others had either once or twice during the semester to go on a remote pause for 2 weeks, and Stony Brook University did not have to. So again, the success of all of that was because of how seriously our students took the guidelines and really owned their personal and community responsibility. The Chancellor, in negotiating with the unions, worked out an agreement that faculty and staff and non-resident students would be also surveillance tested. And we, midway through the semester, implemented pooled saliva testing for those populations. And if you look at our dashboard, if you haven't been there in a while as well, you'll also see all the information, not only for all the tests that we did of our students, but for all the testing that we are doing of our faculty and staff, and that includes hospital employees. The COVID-19 dashboard keeps everybody up to date. It gets updated daily. It's a really great graphic for helping everybody understand what is going on in our campus community. And just as a nice little shout out to our amazing team that put this together, a group of researchers at Harvard and a few other universities rated all of the university COVID-19 dashboards, and we were one of a very small number, really just 2 handfuls of schools that were given a rating of an A. And so I think you will agree that our dashboard is really clear and communicates everything we need to know. Another thing that Dr. Birx had pointed out was her concern about college students returning to their home communities, meeting in multi-generational Thanksgiving gatherings, and perhaps taking COVID-19 with them. Another of the things that the chancellor did was work with all of us in order to ensure that our campus communities would be sending every student home only after receiving a recent COVID-19 negative test. We were doing that anyway, even before the policy came down from SUNY system, but we were very happy to see that all students in the SUNY system had those negative tests before they returned home. We did have a few students who were positive or in quarantine because they were known close contacts of positive students who remained with us over the Thanksgiving break. And our student affairs staff and our dining hall staff did a great job of making sure that those students were given a Thanksgiving meal. We gave them some sort of Sea Wolves goodies, and we checked in on them to make sure that their Thanksgiving in quarantine or isolation, at least for them to know that we were thinking about them. I'm sure that was a tough time for the students who did have to remain here. I certainly hope that all of us will learn something from what is happening post-Thanksgiving about the amount that we travel and that we see friends and families over the holidays, because we're all very concerned about the implications of another surge after more travel over the winter holidays. One of the things that I found very curious from Dr. Birx's visit, and she found it very curious as well, is they didn't understand why Suffolk County cases were so high in the spring. And I think if she were to look at our data now and we were to ask her, she would ask the same question: why are we so high now? It is something she didn't understand in the spring because it wasn't just about people fleeing the city and coming to Suffolk County. There was something going on here. And when you look at our data compared to, even just New York City, you can continue to ask what is going on in Suffolk County with our case counts being so high. So let's hope that behaviors will change and we can figure that out. Related to COVID research, as you know, we have lots of clinical trials underway. We have many faculty who are engaged in a variety of research projects that are related to COVID. I would like to highlight one, and that is that Carlos Simmerling, who is the Marcia Laufer Endowed Professor of Physical and Quantitative Biology, was given the Gordon Bell Special Prize for High Performance Computing because of his work related to the investigation of the virus spike protein and the mechanisms that enable it to infect human cells. His team has been using high performance computing to really understand this at a much more granular level. And this work, of course, is very important, not only for things related to like the development of vaccines, but very importantly also the development of treatment for people who are COVID-19 positive. A lot's going on other than COVID, so let me turn attention to that, and we're going to spend some of our council meeting talking about some of the important things that are underway on campus. Just in terms of leadership searches, we will be launching shortly the Vice President of Advancement and Executive Director of the Stony Brook Foundation search. We now have a search firm in place. We will be working with Jill Lassman from Lindauer Global, and I will be charging the committee, I think, later this week. Many of you may know that at the beginning of the semester, we started a search for the next provost. That committee did great work. They provided me with a very strong pool of finalists, and we are in the final stages of interviews with those finalist candidates. The work on campus, and particularly my work, is very focused on three main priorities. I'd like to mention those as a way of framing where our conversation will be going in a moment. The first of those is the Strategic Budget Initiative, and I'll come back and talk about that in a moment. The second is very important conversations that we are having with the Chancellor about the role of Stony Brook University and the University of Buffalo in the SUNY system. Somewhat unusually for systems of higher education in other states, we have a, let's just say, a system made up of very heterogeneous institutions. If you look at the California system, of the 10 UC schools, 7 of them are members of the AAU, and all of them are research-intensive universities that award PhDs and doctorates and are R1 institutions. We instead have a system that spans from 2 AAU institutions all the way through community colleges, and that is very unusual. SUNY's policy for many decades has been a little bit more towards treating all campuses rather equally and equivalently, and that makes it harder for those institutions that have considerably greater costs, particularly the research-intensive doctorate universities, to be able to manage from a budgetary standpoint. This chancellor very much understands that and is very supportive and anxious that Buffalo and Stony Brook remain strong AAU institutions. And he is very interested in exploring with us changes to the way that SUNY functions and a variety of things around funding in order that we may be able to continue and actually even strengthen the work we do, both around the kinds of research that we do, many of which are vital for the economic future of this state. Just think about the work that all of us do in terms of patient care, of healthcare outcomes, of AI, of quantum, of energy sustainability, of clean energy. These are things that are vital for New York's future, and the chancellor very much understands that he needs Buffalo and Stony Brook to be able to continue to pursue that, as well as the role that we play in educating the talented students of this state. We are leaders in the system, not only in enrolling Pell eligible and first generation students, but in graduating them as well. And that is vital for New York's future. And the chancellor very much understands that. So that is work that Judy and I are very focused on. And as Kevin was speaking about before, it's going to be really important that we have a lot of allies to help us maintain Stony Brook's strength into the future. And my third is to continue our work in strengthening Stony Brook medicine and Stony Brook's health system as leading academic medical centers and providing the best patient care on Long Island and strengthening the work that we do there. So our next agenda item is going to be turning it over to Rose Martinelli, who is our Vice President for Strategic Initiatives. But let me frame our conversation a little bit before I turn it over to her. This is a process that we have initiated this year that is meant to involve our campus community broadly and inclusively. We have 120 faculty and staff who are staffing our different task forces that are part of this initiative. I'm enormously appreciative to them for their time and energy because they are doing a lot of work. The committees have been at work since October. They have now defined their scopes of work and are identifying the priorities, and those will be coming to executive leadership later this month. I'm really pleased with the way that our campus community has embraced this effort. It is bringing our campus community together in creative problem solvings and creative ideas about how we are going to face our resource challenges. They are looking for investment opportunities. They are looking for ways that we can generate new revenue, and they are looking for ways that we can operate more efficiently. I'm really impressed with their commitment, with their creativity, with their deep passion for this institution, and a lot of great ideas are bubbling up. So I'm going to turn it over to Rose Martinelli. She joined us in October. She was previously also at the University of Texas at Austin, where she worked with me in the provost office. Prior to that, she spent more than a decade with Huron Consulting. And if you don't know Huron, they are a higher education consulting firm. And prior to that, she worked at both the University of Chicago and the University of Pennsylvania. She brings decades of deep and broad higher education experience. And I am so deeply grateful of the way she has been working with our campus community and supporting them as they move forward with our strategic budget initiative. So Rose, I'll turn it over to you.
Hey, Maury, would you mind,
Yes.
and Rose, forgive me for interrupting, but can I just check to see if council members have any questions first? On
Of course, Kevin.
The first elements of your report. And in fact, I have two, and actually one is really, I just want to commend you and your team for really the amazing work that you guys have done over the fall semester. Those numbers were very impressive. But I had a question. When you said less than 100, was that just students? And did
Yes.
we have equal success with staff and faculty in terms of infection, low infection rates as well? That's one question.
Yep.
And the other question would be, does the hospital have the freezers that are necessary for some of these vaccines that require super cold temperatures, or did we have to go out and purchase some?
Kevin, I can answer. Oh, Maury, you want to answer it, or I can?
Let me answer the first one, and then Ken, you can answer the second one.
Okay.
The first one is, yes, our faculty and staff numbers have remained low. I haven't actually added those up for the entire semester, but they are also coming in at positivity rates well below Suffolk County. And those are all on the dashboard, and you can find them there. I just haven't done that count recently.
Great. That's great. That's great news. Thank you. And
So
Ken, would you please let us know about our freezer capacity?
Yeah, so as you all know, one of the vaccines requires a minus 80 degrees centigrade freezer. And just so happens that with the opening of the MART building, we prepared a huge freezer farm for research reagents. But right now we have huge amounts of rooms. We calculated we could store 4 million doses of vaccine.
Wow.
So that's not going to be a problem.
Great. That's great to hear. You guys are always a step ahead. So thanks. Any other council members have any questions for Maury before we hear Rose?
Yeah, I do, Kevin. Just a
Linda?
quick one. Yep, Maury, the 100-person, it seems so random. I mean, maybe Kevin can even answer this, where a lot of other schools of this size, 100 is not a huge number, right?
No.
And I know Oneonta, when they sent their kids home sick, and Binghamton did the same thing, it caused more spread on Long Island. And it's my understanding you kept the kids that were sick for Thanksgiving. So we are isolating and quarantining on campus versus sending people home. Okay, I just wanted to confirm that because I know a lot of families that were affected by those two schools with how they handled it by not doing that. And it just seems a little arbitrary, the 100 number, if it can be contained on campus. But I just wasn't sure what your feeling was on that situation. But I'm happy to hear we're isolating people.
Yes, we have lots of quarantine capacity, several hundred rooms, and on our dashboard, you can always see how many we have available.
Right.
We were never, ever anywhere close to our capacity.
Right.
And I will not in any way begin to address that 100 number. But if Kevin would like to weigh into that one, I am happy to let him say.
No, I think I'll leave it there. I think you guys.
Okay, I gotcha. It's all good. It's all
But
good.
actually, you know what,
Listen, the dashboard has been amazing. I've been following it. I have 2 kids in college, so I follow my kids' dashboards. And
Right.
I think you guys have been communicating really well, and the dashboard is really great. So thanks for everything you're doing for the kids.
Great, Linda. What I will say is we do have a lot of colleges and universities on the island. They happen to also be the largest employers on the island, like Stony Brook. And they've all done a really good job compared to other parts of the country and other parts of the state. So they must all be following the Stony Brook model. So any other council members have questions for Maury?
Yeah, Kevin,
Yes.
I wanted to ask with regard to PPE supplies. I know it was referenced earlier, and I remember how difficult it was the last round. Lately, there's been a lot of media coverage of Northwell and all of their warehouse and their supplies. Where do we stand with that? You know, do we feel, I know we have whatever, you know, the amount that the governor has asked, but do we have beyond that? Are we feeling comfortable?
I will ask either Carol or Ken, who's on the call, to address this more directly. It's something Carol, I know, has been working on for months, but Carol, you can more specifically address that.
Yes, we do have warehouse space that we are leasing, and we have the capability to store the 90-day PPE supply and then some. We have been actively working with many different vendors, some of which are non-traditional vendors, to support the PPE supply. We are encountering issues here and there with our traditional vendors. There are instances in which supplies may not arrive on the date that they indicate, or the quantity might not be exactly what we ordered, but we're staying on top of the supply requests and all of our orders. And again, constantly scouring where there are other opportunities to procure PPE and or make our own. So we continue, you know, in that vein. And of course, as the cases and the incidence rates begin to skyrocket, we are actively, almost hourly, counting and tracking our inventory, and we have very strong gatekeeping for it as well.
Thank you. Your team has done, you know, Carol, Ken, everybody. I mean, you guys have done an incredible job, and you know, all of us think of you, worry about you, and worry about your teams as we go forward. That's on the top of our parade also. Even though you're not out there by yourselves, even though, you know, there's limited things of what we can do, but I certainly want you to know that.
We appreciate that, and we appreciate the university support and the community support as well. Thank you.
Great, thank you. Thanks, Frank. Any other council members' question for Maury? All right, well, hearing none. All right, Rose, Maury just gave you a terrific introduction. We enjoyed meeting you for the first time last meeting, and we look forward to your report now.
Great, thank you very much. The last time I met with you was day 4 of my time here at Stony Brook University. I'm a couple months into the project, and so I thought I would give you an overview of the strategic budget initiative, about our progress that we've made over the last 2 months and kind of the directions that we're going to take. I'd like to share my screen if I may, and kind of walk you through where we are. All right. So as we give you a quick update about where we are, I thought we would ground our discussion first in what the goals were first for the strategic budget initiative. And there were 5 areas that we identified that would be very, very important as we move forward. One was to strengthen and focus our research endeavors and really think about how do we collaborate more effectively to expand our research productivity and enable new research. The second was to think about how do we integrate the hospital and clinical practices into more of a one campus identity. The third was to look at our academic programs and to see if they are able to meet the ever-evolving needs of our community and workforce demands. The fourth was to think about removing unnecessary duplication. And the fifth was really about how do we better utilize our campus resources as we serve both the Stony Brook community, but also the Long Island community more broadly. So as we started our work together, we decided to focus on a structure that would allow us to build upon community engagement, to really foster the understanding of where the opportunities lie, and to coordinate how we as a community could better understand how to work more effectively together, and to use the people who do the work day to day to come up with the ideas and opportunities to strengthen the enterprise. This very complex chart really is a way of showing you the kind of the organizational structure of how we've worked together. We have 5 focused task forces that report to the Financial Sustainability Steering Committee. We meet weekly to discuss kind of shared goals and objectives to make sure that we're aligned together. We've also been meeting with the Executive Leadership Committee on a regular basis to help share kind of where we're heading in terms of the priorities and some of the challenges that we're facing. They've been able to give us a little bit more of guidance and focus as we've gone forward to think about things to prioritize as we do our work together. But principally, the work is being done by the 5 focused task forces. And I want to spend just a few minutes on each one of them so that you have a better idea of the areas of focus and the areas of opportunity. The first of the task forces that I want to talk about is our Academic Portfolio Task Force. This is being chaired by 2 of our distinguished faculty members, Axel Dries and Leonie Huddy. They've been focused on, over the last 2 months, of really understanding the current challenges and obstacles that we face in terms of delivering our academic programs. And as we're moving forward, we started to think about where can we have the biggest impact on this community. One of those is really focusing on how we develop new tuition revenues through expanding our graduate programs and creating new interdisciplinary undergraduate programs that can attract non-resident students to Stony Brook. A whole new area that we've been lightly dabbling in is this expanding our non-degree professional and continuing education. We've done a little bit in this area, but based on who we are, who we serve, our campuses in Southampton and here in Stony Brook, we believe that there are huge opportunities for us to serve this market in an ever increasing way, both online, hybrid, and in person. The third area that we really struggle with is a lot of what I would call the approval processes with SUNY and the State Department of Education. We've been, let's just say they've been challenging. We have many programs that have gotten stuck for a year or 2 years in the approval process. And so we're focusing on how best to streamline that and enhance that going forward. And then finally, the whole notion of graduate education really is in connection with our research enterprise. And so how do we attract the very best graduate and PhD students here, provide them with a high quality experience and the outcomes that they deserve, and that we need in academia to foster new colleagues in the ranks of higher education. So one of the biggest challenges that we have coming out of the gate is our incentive programs. At the graduate level, it has not been clear how we share revenues in order to expand our program reach. And that's sharing revenues with the departments that create the programs. And so we're launching a working group this very month to talk about tuition revenue sharing, to really look at this from the lens of the departments and the incentives they need to bring in staffing and to share in the revenues while growing our graduate programs in preparation for launching new programs in the future. Our second task force is operations alignment. It's chaired by 2 staff members, administration members, Carmen Gonzalez and Michelle Singletary. This is a group that's really been focused on how do we derive greater power from this institution by collaboration, improving our efficiency, reducing duplication of efforts, and thinking about containing costs. So a couple things that are really important here. We have more than $100 million in vendor spends every year. We do them same on the East Campus, and we do them the same on the West Campus, oftentimes using the same vendors, but not using the same contracts. That duplication of efforts is really driving up our cost as we work across the campus. And so we're really thinking about how do we do a better job of aligning our efforts, using the power of our shared dollars to bring down costs and actually drive up service. And so this group is launching a number of working groups that are focused on working collectively together to drive out the obstacles. The first is in the cost containment area. We're working very closely with Carol Gomes on the East Campus to really look at our vendor agreements and streamline them, and perhaps even drive out 10% of costs by just looking at and reevaluating those contracts. The other area that's really problematic is our hiring and recruiting processes. They are different across both sides of the campus and very much paper-based and policy-driven. And many of the policies are a little outmoded for today, and so we're looking at that. And then finally, we have a third working group around external clients and running facilities to external clients. We have enormous facilities that are incredibly valuable and very beautiful and usable, and we don't use them very well. We don't have the types of relationships within the community that would allow us, and many of the perceived policies and practices between SUNY and our ability for revocable permits have been problematic, and so we're working on streamlining that. We believe we can really drive revenues through our facility rentals in the future once we're past COVID. So this exercise will help us learn much more about how to do that better and how to work in collaboration with our university and regional partners. The third area is Stony Brook Medicine. It's also led by two faculty members, David Tanasi and Aaron Sasson. This is a group that has been focused on working to look at how to streamline the work and better collaborate within the health system on the east side of the campus. We've been waiting on the report from AAC, which we just received, and we'll be delivering that to the group later this week. But it's about understanding and evaluating the relationships between departments and institutions within the Stony Brook Medicine, increasing engagement and transparency in decision-making, and optimizing fund flow strategies as we get to work there. The next group is optimization of campus resources. Again, this is looking at how we better use our campus more effectively to drive revenues and to ensure that we are working collectively together effectively. Their three areas of focus have been looking at the utilization of facilities and programs, as I just mentioned, exploring business partnerships and sponsorships to enhance our branding opportunities on campus, and then optimizing cultural and athletic resources as we get going. This group has really been stimulated. More than 100 opportunities have come into mind, and they will be delivering their opportunity prioritization to us a little bit later next week. And then finally, the last of the groups is our research and innovation group. There is so much opportunity for us here at Stony Brook in terms of improving and enhancing our AAU standing. So much of the work of research here has been more narrowly concentrated into a number of faculty members. And what we want to do is really focus on increasing collaboration in our research efforts and expanding faculty research productivity. So there's so much going on here, but we've been a little bit blocked again by our own inability to really connect and work together. For instance, it's very hard for campus researchers to understand who else on this campus is working on a similar project. It's almost like a match.com a type of approach about trying to connect our faculty going forward in shared areas of research interest. And then lastly, we want to get going in terms of leveraging our existing research enterprise. We do things slightly different east and west, and so we're trying to consolidate and establish shared ways of working together going forward and make sure that we're using our space and facility as they stand right now in terms of enhancing our way forward. So our project timeline, I just want to kind of review where we are to help you understand the length of work. So this project lasts through April 2021. We've just completed our opportunity identification, and we'll be sharing that with executive leadership here in about 2 weeks on December 18th. This first round of priorities will begin to shape the way forward as we work together as an institution. A couple of things that I think are really important as we start our work. Prioritization and understanding the sequence of opportunities will be enormously important as we go forward. And the next step that we'll be looking at is the analysis and validation. We've got great opportunities. We're looking at where are there obstacles and what are we called constraints for us to work together more effectively. And in step 3, over January and February, we'll be looking deeply at kind of what are the cost benefits, the risks in terms of moving forward in order to develop the implementation plans that will be required to go forward. That work will come back to the executive committee, and then we'll make decisions going forward. So there's a lot of work, a lot of ideas that are happening here within the Strategic Budget Initiative. And I've been so excited by the opportunity to learn from so many people who are passionately committed to this effort, recognizing we can't cut our way to success. We actually have to grow the enterprise and really open up the entrepreneurial and innovative engine that stands behind all the assets that we have. I've been astounded. I joined just 2 months ago, and one of the things that I have really been excited to see is the energy and the amount of unique assets that Stony Brook University has that, if taken together, integrated and collaborated and communicated and coordinated together, we could really design very unique programs to attract students from across the world and across the nation, really enhance our research standing, and level up, really kind of capitalize on our current strengths in growing and enhancing the university. One thing that I think you've all probably have seen is, if you read the Chronicle of Higher Education, most institutions are in the cutting and the furlough and the kind of ending of programs. Here at Stony Brook, the president and executive leadership took a different course. It's not to say that we won't need to cut in the future, but if we could grow and we could use the excitement and the passion of our faculty and staff, we could actually turn on our revenue engine so that we could build upon our strengths and actually leapfrog to very different places in the future to grow our enterprise. So that's a little bit about where we are, and I'm happy to take any questions that you might have.
Thank you so much, Rose. That was a terrific presentation. And Maury, my hat goes off to you and your team again. This is smart management, and we need to be looking at things that way. Suffolk County is the largest single site employer on Long Island, 14 to 15,000 employees, a multi-billion-dollar business. And these things make sense to do, even regardless of the state financial issues that we're facing. And so I think it's smart that we're doing that. And I think even the governor has acknowledged that our original hopes for getting a lot more money from the feds is unlikely. And, it started out with a $3 trillion CARES Act by the House of Representatives. And I think we'll be fortunate if they could cut a deal for $908 billion before the end of the year, which means a lot less money for all the things that are needed. Remember, the state has big needs. It's not just SUNY.
That's right.
I sit on the MTA board, and the problems dwarf the SUNYs, which is scary. So this makes a lot of sense. Rose, everything you said sounded logical, and I look forward to the process continuing and participating in some of the discussions as we get closer to the spring, and as you get more final with some conclusions and recommendations. Do any of the other council members have any questions for Rose? All right. Well, Rose,
all right, Kevin, I just want to say something very quickly. First of all, thank you for your comments. And secondly, this is a moment where the objective and the work that we are doing is to ensure that Stony Brook is stronger in the future. And if we have the courage at this moment to do this, some of which is going to make some of us a little uncomfortable, it will inevitably mean change. And humans are what humans are. We're always a little bit nervous and have a bit of trepidation about change. But if we are really courageous at this moment and do this work, which I believe we can do, I think Stony Brook 5 years from now is a much stronger institution.
I totally agree. And we'll all be better for it. So good luck with this process. All right, no other members of the council have questions for Maury or Rose. We'll continue with the agenda. Next item, appropriate concern in my opening remarks on changes in Albany. The council has the ability to award these medals of honors to very distinguished Stony Brook connected folks, whether employees, faculty, staff, or members of our external teams, including the state legislature. And we wanted to recognize Senator John Flanagan and Senator Ken LaValle. There's going to be a ceremony on Thursday that I believe all council members will be invited to or have been invited to. But we need a motion from the council to approve the awarding of these medals, and I'll move it, and Linda Arman will second it. Do any council members have any concerns or comments on the resolution before a vote? Nope, hearing none. Hearing none. The motion is approved. Judy or Mike Aarons, if he's on the phone, do we have a picture of these medals that we'll be handing out? Or will everybody will see them on Thursday?
Well, yes, we do.
I thought we did.
I don't know if you can see it, but but it just crashed my computer.
I need a new medal.
Now we need a new one.
And it says, so this side, Stony Brook University of New York, and then the other side is Stony Brook Council Medal of Excellence, Outstanding Service to the University of New York. And it's a medal that was created some years ago. Not many have gone out, and it's pretty special to put it out. So
very good. Maybe between now and Thursday, when we award these to Ken and John, you could give me those facts and figures, what date this started and how many have actually been issued. That'll be useful.
Sure.
Great. All right. So thank you for that. That motion is approved. And our last item on the agenda today, we're going to have a presentation. This is why some of the deans have been joining us today. We're going to have a briefing on the public perceptions of research universities with Pedro Ribeiro and Ken Goldstein. Maury, do you want to tee this one up for us as well?
Yeah, I'm very happy to do so, and really appreciate our colleagues, Ken Goldstein and Pedro Ribeiro from the AAU, who are going to highlight for us their research and polling related to public perceptions of research universities. I have heard them present this material several times as it has evolved over the last few years. And every time I get new insight into ways in which the great research universities of the US are perceived and how that varies. I think we all find it very easy to imagine that self-evidently everybody believes that higher education is important and a good thing. And I think you will learn today that that is indeed not the opinion that absolutely everybody has. So Pedro has been the vice president for communication at AAU since 2017, and he oversees and coordinates AAU's public affairs, their communications, their media relations activities. Before joining AAU, Pedro was the Deputy Assistant Secretary for Public Affairs in the U.S. Department of Homeland Security. And he earlier served as an Assistant Director of U.S. Immigration and Customs Enforcement. Prior to working at DHS, he worked in Congress and on the staff of the mayor in the District of Columbia. Ken Goldstein is a senior fellow at AAU, and he directs survey research on policy issues and is a professor of politics at the University of San Francisco. He is based, however, in Washington, D.C., and is the founding director of USF's in D.C. program. And he's the academic director of USF's Masters in Public Leadership that's focused on veterans who want to continue their service in elective office. Ken's PhD comes from the University of Michigan, and he was previously a faculty member in the political science department at the University of Wisconsin-Madison. Ken is one of the country's premier experts on political campaigns. and the use and impact of advertising in particular. He is a senior consultant for the ABC News election unit, where I can actually say he works alongside one of my good friends from the University of Virginia, and they are part of that election night decision team, which often has now, in the last couple of elections, stretched from election night to election and the several days thereafter. He's worked on this network election night coverage in every U.S. federal election since 1988 and is also a frequent contributor on TV and radio. So Ken and Pedro, I'm going to turn it over to you.
Thank you, Maury, and thanks for the chance to present to this group. So a couple things up front. So AAU, the Association of American Universities, is somewhat of a misnomer. We don't represent the entirety of American universities. We represent a relatively small subsector of that, which is America's leading research universities. We represent the 63 leading American research universities and the 2 leading Canadian research universities. And one of the things that I discovered when I joined AAU 3 years ago was that while there was a lot of public survey information out there about colleges and universities or the higher education system, there was very little that was actually available about research universities, and in particular, America's leading research universities. And so that's how we get to this work that we have here. Ken Goldstein, my research partner, has been doing this type of work specifically for the University of Wisconsin for quite some time. And when Ken and I met, we had this idea to really kind of take a deep look at what Americans think about research universities, which is a very specific group and a group that is pretty small. If you look at the R1 universities, and even smaller if you look at the AAU membership, and Stony Brook isn't a very rare group to be an AAU member. And we've done this research for a couple of reasons. One is we want to know if Americans really understand what a research university is first and foremost, and what drives those views if they do understand that, and what shapes their narrative around research universities in particular. Given the amount of time we have, we're just going to kick it right off, and I'm going to turn it over to Ken to start the presentation. If you have any questions during the presentation, just drop them in the chat. I'll do my best to address them. This is a lot like baseball. Ken is the presenter and I'm the color commentary, and then we'll do some questions at the end.
Great, thank you so much, Pedro, and it's great to be here with everybody. I do want to, with Maury, I first got to meet her when she was the provost at the University of Texas, and Pedro and I were going to visit Austin. So I asked my closest friend, Paul Friedman, who worked with her at University of Virginia, what do you both know about, because provosts are a little scary, right? So, what do you know about this provost person at Texas? And he said, yeah, she's actually pretty cool for administrator. So you obviously did a good job. As in addition to her incredible record, you got according to my Paul Friedman, a pretty cool administrator. Another reason why, I want to say it's exciting to be here speaking to everybody at Stony Brook. One of the things that Pedro and I are trying to do with this AAU project is blend theory and practice, take some of the nerdy things I have learned as a professor, and I've probably done a little bit more in the real world than most professors, and use that on behalf of great institutions like Stony Brook. You actually have 2 of the best people in public opinion at Stony Brook in terms of Stanley Feldman and Leona Huddy. And I'm not even sure Pedro's heard me say this before, but in terms of how I understand how to design a questionnaire and how I write questions, have been very much influenced by the work of those two great scholars. And now a little dramatic, but Pedro and I are trying to weaponize, if you will, some of that academic research to give you some clues about how to communicate better. So let me just jump right into it here, and I really think it's going to flow very, very well. And Maury, this might have even been the plan from the conversations that went before about the important work that you're doing about COVID, and then the strategic plan that is going on at Stony Brook. So this project started, like Pedro said, I was a faculty member for many years at the University of Wisconsin. Before I did that thing which happens to people, which is you come to DC for 3 months and then 11 years later you are still here. And I got to meet Pedro in summer of 2018, and this is actually a slide from 2019, but there was a similar report that came out in 2018, which was both Pew and Gallup, and I'll show you the data in a second, coming out with these big headline reports, and this was actually the front of the Pew webpage, indicating or arguing that Americans have a deeply negative view on higher education, and that, like everything in our world, has become deeply polarized, with the Democrats not liking us, but Republicans not liking us even more. And this was the finding from the 2018 Pew report, which showed right direction, wrong direction, sort of a classic sort of question that is asked in politics, and that the higher education system, and I'm sort of saying that with some effect and some snark, because I want to talk about why that's a weird way to describe it. The higher education system, that we are deeply underwater and also deeply polarized. Gallup doesn't ask the higher education system, but asks higher education. And even though we're number 4 here, below the military, small business, and the police, the headline and a lot of the media coverage was about how we were declining, how we were underwater, and how it was deeply polarized. So even before I got to meet Pedro in late summer of 2018, and before we did our first work, I remember thinking, and many of you may have seen these Pew and Gallup studies, at the sort of things, right, that people who work in university administration, this sort of flies through everybody's email and everyone sort of sighs and looks down. I remember thinking higher education system is sort of a weird formulation. It's sort of a scary, awkward sounding term. It sort of sounds like the military industrial complex. All of you who are deans and administrators and working in it, if you were at the dog park talking to someone and they asked you what you do, you would never say, I'm in the higher education system business. For those of you who are serving on this council and putting in time to help our universities, you never have to say, oh, Monday morning I have to run to my higher education system board meeting. So the first thing that Pedro and I did was experiment with different ways of talking about who we are. And you've heard the term AAU mentioned, and Pedro and I are with the AAU, and Stony Brook is a member of the AAU, which is obviously the group of the top research universities in the United States. But our goal wasn't to brand the AAU, but to see if we could talk about ourselves in a way that people would understand better what we're doing. And so we came up with a number of different ways of describing AAU in that summer and fall of 2018. And the best formulation was America's leading research universities. And I'm sure a couple of you have had a little bit of experience in politics and have seen some surveys and have seen some message testing in your day. And you know that it's often not just that one magic word, just say broccoli and don't say asparagus, and everything is okay. But this was a case more than Pedro and I have ever seen in our careers, where simply describing ourselves in one way versus the other makes an extremely large difference. So we've been testing this over the last 2 years and tested this extensively initially at first, but I'm going to present to you a lot of data here from a recent set of studies that we did. But completely serendipitously, we were in the field in fall of 2020, just a couple weeks before the election, at the exact same time that the good folks at Pew Research were in the field asking their system on the higher education system. And you see, we are underwater on higher education system, 41 to 56%. Completely by luck, we were literally in the field the exact same days with them. Not by luck, I was making a little bit of trouble. I used SSRS, which is the survey research field house that Pew uses. So we were in the field at the exact same time, using the exact same methodology at Pew with their field house. And when you ask higher education system, we're 15 percentage points underwater. When you ask right direction, wrong direction of America's leading research universities, it is plus 40%. Obviously, a huge, significant difference there. And you see that difference is not only overall, but we improve significantly with Democrats and also significantly with Republicans. Again, the exact same probability study method as Pew with their exact question, except we use America's leading research universities instead of the scary higher education system. Using different methodologies, different field houses, different modes, we continually look at this. And what you see is that America's leading research universities, or the leading research university in your state, which we're trying to get people to focus closer to home on, also performs better, not only than the higher education system in this split experiment, but better than the more benign colleges and universities. So overall, over the last 2 years, Pedro and I have conducted interviews in which we've interviewed over 200,000 Americans. We are constantly in the field with weekly tracking polls, tracking core measures, and then when a crisis or drama pops up, we are able to jump in and get measures there. Twice a year, when the chancellors and presidents meet in April and October. So Maury saw much of this at the October chancellors and presidents meeting. She's now at the better end of the cycle. The provost used to meet like right at the end, so she would see like 5-month-old data because it was just before the chancellors and presidents. So now, you know, she gets to see the freshest data. So we do large national studies in advance of the chancellors and presidents meetings in April and October. We go in with different sorts of jumping on different surveys, University of Chicago, SSRS, other field houses to validate our methodology and also be able to do something like compare it with Pew. We've also done a number of in-state studies with various institutions. And we go in from time to time and do deep dives on access and affordability, diversity, race and admissions. And we were about to go in the field this week with a study on student loan debt for forgiveness. So what I'm going to present to you here are data from the fall 2020 study, which was a large national study with all instrumentation, all questions on America's leading research universities. The omnibus study, so we could look at our core measures with the probability study. And then we are constantly in the field with the tracking study from SurveyMonkey. And I should just note, it's not just the signing on to SurveyMonkey and surveying your friends, but SurveyMonkey has a public-facing product that we use, which is a river sample, which is a nationally representative sample of US adults. So one obvious question is, I've been using this term, America's leading research universities. Hopefully, I've convinced you that that people rate America's leading research universities much higher than this other scary term. But people actually know what America's leading research universities are. Do they know the difference between a Stony Brook and then Maury was talking about there's wide variance, and I have some experience. This was also the case in Wisconsin, where there's wide variance in the colleges in the system. Do they understand the difference between you and Buffalo and some of the other institutions in the state? Well, nationally, they clearly do. And I'll just focus on the October responses here. We asked an open-ended question. Name 3 of America's leading research universities. 87% of all the responses were actually AAU institutions. 92% of the responses named at least one AAU institution. 85% of the responses named an AAU institution as their first selection. And the top 24 most frequently mentioned were all AAU institutions. Now, what were the top 5? Well, and this is sort of the top 5 over a couple different times we've done it. The top 5 have not changed: Harvard, Yale, MIT, Stanford, and Johns Hopkins. We were surprised when we first did this how highly rated Johns Hopkins was. And then we saw a pandemic boost with Hopkins in the early days of the pandemic, but still solidly in the top 5. And then, and I'm going to take a breath here in a second and turn it over to Pedro. What we also noticed was when people made mistakes, and I think this will be very interesting because I heard so much in these early presentations about the incredible work and the incredible footprint you have in the medical and health area and the incredible work you're doing about COVID, when people make mistakes, they will say things like MD Anderson, the Cleveland Clinic, Mayo Clinic. So that, in combination with the Hopkins, in combination with some other stuff I'm going to show you, suggests to us how important that medical health, not a marketer, so I always think it's weird when I say brand, but that marketing medical health brand is for universities. Let me stop here and have Pedro share a few thoughts on that.
And so standard disclaimer I give, AAU does not rank its members. We don't do this survey to do like a US News and World Report public ranking. As a matter of fact, our findings are not public. We don't share this with the media or anything. This is for the internal use of AAU members. But the reason we ask this question is twofold. One is it's to reaffirm the fact that whether Americans actually understand the difference between a research university and a college and university or a community college. And this proves that they do. But also it's to see what the changes in the data show as trends. Now, we all know, and if you heard one of the presidential debates, you actually heard President-elect Biden cite the Johns Hopkins tracker. There's a reason for the movement of Hopkins. It's the tracker. And Ken and I actually just did the Johns Hopkins Board of Trustees on Friday morning. And that was a big discussion about, so it's clearly that people are paying attention, the American public is paying attention, and they're internalizing what they're hearing, especially about things happening in the medical field. And if you look at Stanford as well, for those of you who aren't familiar with Northern California, Stanford is actually a very large healthcare brand in Northern California in the San Francisco Bay Area. So their numbers and their movement has been trended to stories coming out of the Bay Area and California as well. So it makes clear sense when you look at this, and then you look at media mentions, which is something else that AAU does, and you compare the two, and it syncs almost perfectly.
And then we also asked it a slightly different way on the last study, which was we did a very large national study. So what we were able to do is randomly give everybody 8 different schools, and they could check all that apply. Which of these are among America's leading research universities? And you see that top 5 again, but with Hopkins number 1 there. And as I was hearing the various reports from Kevin and hearing Maury talk, I think it'd be super interesting. The Stony Brook number nationally is not going to be quite as high as those, but would be really interesting to see what the Stony Brook number is on Long Island, in the New York City area, and in the state. Both as a research university and the perception of you as the major player in healthcare and medical delivery and being on the front line of COVID. I know a bunch of you are in politics and a difficult business and sometimes a nasty business. But at least you know what your major question is, right? You know what you're trying to move, which is the ballot question. Pedro and I struggle a little bit about like what's our ballot question, what's our election question, what's our dependent variable, and so we used a couple of them, and one of them is this right direction question. And again, we of course use America's leading research universities, but this is a version of that Pew question, and this shows the right direction margin, so the difference between right direction and wrong direction since fall of 2018. So I gave you the answer there, right? But you can see that we were plus 22, and then literally the first day that I started as a senior fellow, we went in the field. A couple days later, the Varsity Blues indictments dropped. So we have that drop to +3, fighting our way out of that, a pandemic boost, and then a decrease in mid-April. And you can sort of think about why that might have been the case, but that mid-April day is when the CARES Act drama came and the president and the Secretary of Education and all of Fox News criticized many AAU members for taking funds from the CARE Act. And you see that sharp dive that we had in Republican support there. This is our question: which is most sensitive to the drama of the day? So when we do polls regionally or statewide for university, not every university did as well as you or were as fortunate as you were in terms of students and COVID. So when there's a particular outbreak and there's bad press coverage of a particular institution, this is the question that we will see move on that. This is the question that is most sensitive about that. Another core question that we use: the value of a degree. We have limited time with you here, and we have a whole presentation on access and affordability and how expensive it is. And there's big debates that go on among the provosts and the chancellors and presidents about, do you focus on talking about the value of the degree, or do you focus on talking about how it's actually not that expensive? We ask a question here which gives people three choices. Are our degrees valuable and worth the cost, valuable but not worth the cost, or not valuable at all? So the good news always was very, very few people think they are not valuable at all. But we had a number where we were -16, and this sometimes would go over 50% of valuable but not worth the cost. And Pedro and I would have lots of discussions saying it's going to be hard to move that number. We're realistic about being able to win on that number, but can we at least get that closer so that we can have an additional conversation with people about the additional benefits that we have? And we've seen a boost in that number as well during the pandemic. Let me pause here and have Pedro say a couple words on this.
Yeah, I mean, I think there's clearly a halo effect there for some of our value numbers. Now, this is an issue that Ken and I are just kind of glossing over. We have an entire stream of research that focuses exclusively on this particular issue, and there's a lot more to discuss here. There is some troubling data that comes out of this, which is Americans believe that a degree is valuable, yet they believe that they cannot afford it. Right? If you want something and you believe it's valuable, yet you can't get to it, that sends a certain message. And so this is something that we pay a lot of attention to at the association level when we do research, which is cost, affordability, and accessibility.
Hey, Pedro or Ken, it's Kevin. Did you break it down by public AAUs, and would that figure go up significantly about valuable and worth the cost just for public AAUs?
So we don't do it at the national level. We not in this survey, but we have before. One of the things that Ken and I also do is we're actually the in-state survey researchers for several AAU institutions across the US, including your friends to the south. We are the Rutgers research analysts, and we've done it for UT, where Morey was before. We've done it for Wisconsin. And the numbers shift depending on where you are in your state, but not to the point where you'd say we're winning the fight.
Got it. Thank you.
And Ken, I don't know if you want to add to that.
Yeah, another thing, Kevin, in this last big national study, the sample size was so large that we were able to do fairly modest add-ons for 10 different large states. So we have state representative studies. So when you folks in New York finally finish counting all your votes, we will have the final results from New York, and the reason why we're doing that is we're weighting the final results in each state so we have valid state level numbers. So we're still waiting on New York and California, and that should be finished up this week. But what we've noticed in the initial work we've done in the 10 largest states in the country, there is variance in this number. So there is variance between a Texas and I don't think I'm telling any tales out of school here, and Morey used to be at University of Texas. University of Texas actually does really well on this number of people thinking it's valuable and worth the cost, and other major state flagships of top public universities in these states tend to not do as well. In this national study, to Pedro's point, we can't split it out, but when we do the state level stuff, you do see variance in how universities are perceived.
Yeah, and at the state level, I mean, in a state like New York, where you have both elite privates and elite publics, because the question is generally, right, where we didn't ask, do you think the SUNY degree is valuable or worth the cost? There's a lot of inference there too.
Makes sense. Thanks.
This is one of our favorite questions, right? It's always bad teaching to say one slide's your favorite, but one of our core measures, and a question we've done a lot of work with and a lot of experimentation on, as the first thing we do, and then those of you who are in politics are used to this, right? You do a message against you. And so what's the message against us? That we just serve the rich kids and the well-connected, and everything's going on in this ivory castle, and nothing that these universities do makes much of a difference in my everyday life. Versus a variety of other things that we could say about ourselves. And in terms of the variety of other things that we could say about ourselves, in our early work, we found that groundbreaking research in science, medicine, and other areas that will make my family better off, even if it's unlikely that me or one of my kids is going to go to one of these institutions, is the message that works best. And so we've continually tracked that over the last year and a half. And again, pandemic, we see a significant boost. That number used to be about a third, and now, and with the third being don't know. And now we see that there is a strong advantage where people think America's leading research universities are providing benefits to them, even if they are not going to directly go to one of those universities. And let me pause here again and have Pedro say a couple of minutes, because I can't say how important enough this particular finding is.
Yeah, and Ken and I, for a long time, we've had a joke that we used to do at every time we did the Ken and Pedro show, which is, when the aliens come in the movies, what's the first thing that the president does? He calls some professor at MIT and says, can you guys build a laser or whatever it is, right? Whether it's, Armageddon or all this stuff, they're always going to call somebody, and it's always going to be an MIT guy or a Harvard guy. And we would joke that, they may hate us, but when the aliens come, they're going to call us. And this slide actually kind of bears that out in a troubling sort of way. An alien did come, and it's a virus, and it's killed over 200,000 Americans. And the people that the public is turning to are research universities. They understand that if a vaccine is going to come from somewhere, it'll probably come from a research university. They understand that if you want the best healthcare possible from a direct healthcare delivery, the place you probably want to go to is a university hospital, or to a place like Mayo or MD Anderson. And MD Anderson's actually has strong ties to the UT system. It's actually part of the UT system in some ways, and then to the Mayo Clinic. And they confuse those with research universities, as our research has seen. And so there's a lot going on here, but it is directly driving people to look at research universities as a place for salvation in many ways.
Hope is nice these days.
Yes, very much so. That's absolutely right. That's a great way of putting it. And hope is they're looking at us. And for some of the other work that we do, if you look at the conversations about the Moderna vaccine and Vanderbilt and Dolly Parton, it sounds like a joke, but it's not. Huge impact that discussion has had in a place like Tennessee for Vanderbilt.
Yes, a lot of publicity lately, and good for them.
So, just to make the point here that there's different messages we could use to talk about our benefit. One is clearly an economic message, and I've heard that discussed here. We've shown pretty clearly in our national polling and also in our state level polling that the research focused message does better with the mass public than the economic engine message. But to be clear, we're not saying, and I've heard Kevin talk about it a number of times, I'm not saying, Kevin, don't mention that SUNY Stony Brook is the biggest employer on Long Island. What our evidence suggests, though, is when you're talking to a mass audience, the research message is better, but certainly when you're talking to business leaders and business associations and government leaders and elites in the area, the economic message is certainly valuable. But our information in state level polling we've done and national level polling clearly shows for the mass public that the research message is is better. And we've actually done a little bit some deep dives, and I'll let Pedro comment on why people don't understand as well as we might like how we are an economic engine.
Yeah, and some of the work we've done for Midwestern institutions, particularly in the state of Indiana, it's clear that when we've compared some messaging, we've done some testing, we looked at some of the stuff that they're saying is that when universities tend to talk about economic impact, they usually talk about it as a top line number or top line jobs. And that works with state legislatures. It works with members of Congress. I know I used to work in Congress and was the chief of staff there. So I understand all that impact that has. But when talking to the general public, a lot of what we say about economic development flies over people's heads, and it does not resonate with them because they do not put themselves in a place where they think that they will get a job at a place like Stony Brook, right? When you talk about university jobs, people automatically, wrongly, but automatically assume that you're talking about jobs for professors and doctors and people like that. They forget, and no one really ever tells the story about all the facilities people, all the maintenance people, all the janitors, all the cooks, all the other ancillary jobs that come with running a small city. And that's a story that goes untold. So people do not connect in a way that they connect with on research. Because on the research side, on the healthcare side, everyone knows someone with Alzheimer's, with Parkinson's, with cancer, with these debilitating conditions that they know that research universities are doing research on, and you can get treatment for at a university hospital. Big disconnect there. And we have a lot of data from the state level work we've done that clearly indicates that.
It's good. It's good to know. I'm going to need to change my stump speech now and highlight the research and play down the economics.
I'm not, like Ken said, we're not asking you to abandon the economics, Kevin, but it's more about telling a more targeted picture, right? On the economic message. So yeah, for the state legislatures, I think you guys are doing an absolutely fantastic job with the way you're delivering it. But if you're going to go, to Kiwanis or something like that, or Rotary, you might want to sharpen it down. And that's what we tell people when they're doing their stump speeches and their pitches.
Yeah, it's good information to have. Thank you.
Also, Cornell University actually did one of the better jobs of doing a spot combining the research and the economic. Maybe I'll have, Pedro paint that picture for you, because obviously New York focused and New York State Legislature focused.
Yeah, I don't know if you've all seen it, but Cornell did one ad as part of their economic impact storyline that they're trying to tell. Because obviously, look, they're seen as I don't think it's by any surprise that as New Yorkers, you'd probably see them as an elite, disconnected institution from the state. They did an ad that was about advanced manufacturing, and the ad is a guy who lives in a trailer and drives a dually truck and goes to work every day in a machine shop, and he's actually building parts for particle accelerators at Cornell. And the pride that this man has, who never went to college, will never go to Cornell, his kids will probably never go there, talking about his partnership with Cornell in advanced manufacturing, and how he as a machinist gets to work with Nobel laureates, and how and then it's the small, and then there's also the small business side of the story, which is the small business in upstate New York that makes all these specialty parts, and they're just a machine shop. But the pride that they take in doing that work resonated very well, and that ad tested very, very high because it's very pointed and very direct. And then here we have the breakdown of the messaging, right? The research messaging versus the economic messaging. And these are, like I said, like Ken said, these are top line national numbers. The state level work we've done on this reinforces this even more. So when you're actually using a name brand, reinforces this.
One other thing I want to point out here, and then I'll probably just show a couple more slides so we can have time for a couple questions. We're not showing you a lot of the internals here. We're providing that to all the universities, but reassuringly on many of these questions, you see pretty strong consistency across demographic and partisan subgroups. But what's been interesting to us on all of these core measures, the group we do the worst with. So for those of you who follow politics, you may know everyone's become an expert on non-college educated whites in the Midwest. And it's crucial to get non-college educated whites in the Midwest correct if you're going to get the polling correct. And so we pay a lot of attention to the nerdy things of weighting and demographics and race and education. What we noticed is there's actually pretty big differences among people without a college education, depending on whether they have just a high school education, a community college education, or some college. And as I'm sure many of you know, and I frankly did not know about this before I started doing this work, 20% of Americans started college but didn't finish. And so that is actually the group that we do the worst with. And when you think about it, of course, it's not surprising. And Pedro and I sort of had this Captain Obvious moment that you started college, you understand its value, you want the degree, but then because either you failed out or some professor didn't treat you right, or you ran out of money or something happened in your family, you had to stop, you had to drop out of college. And both in terms of what we can do to help people and to help ourselves and people understanding how important we are, that is a very crucial segment of the population. Let me just share a couple more slides here. We asked an open-ended question in October, and we were expecting a little bit that people would say all sorts of nasty things about us, but the sort of liberal agenda on campus and negative information about reopening really was very much in the minority of responses. And over 1 in 3 people in an open end not only talked about research, but talked about COVID-19 research. And then also significant numbers of people talked about research in general. Let me show you one last slide. I have a bunch more, but I know we're a little bit limited on time here. In every single study, we ask a series of traits. And again, for those of you in politics, the cares about people like me, shares my values is a classic question that one would ask. And those numbers are low. They're actually an improvement on where we used to be. I would like more than 15% of people to say we share their values. I would like more than 18% of people to say cares about people like me. But you have much larger proportions of people saying we make important scientific discoveries, we're innovative, and then a question we just recently started asking, crucial players in response to the COVID-19 crisis. And what we see is not only are those science, research, innovation rate highly at the top end, but when you do an analysis and you look at how they drive other attitudes, they are very strong drivers. So put another way, or even crassly, people can think we don't share their values, but if they think we make important scientific discoveries and are innovative, that will drive positive views on us on those different ballot questions that Pedro and I were discussing before. So let me stop there and give folks some time for questions. Maury, there's more slides here, and obviously we can make the deck available to you with chancellors and presidents. You can make the deck available to your folks here, and then we also have some more written work coming down on this. But let me pause here and see if people have any questions or comments. And thank you very much for having us here today.
Great. Well, thank you, Ken and Pedro. That was really very interesting. And Maury, it sounds like information like this would help with your efforts that you shared with us about Stony Brook and Buffalo, as we're trying to get Albany to look at our research institutions, the only 2 AAU institutions in the SUNY system, to be treated differently. And it sounds like information like this, especially if we could do some tailored just for New York State residents, might be helpful to those efforts.
Absolutely, couldn't agree more, Kevin. That's why we thought this would be a great starter to that continued conversation as we think about how do we continue to elevate among the state people's understandings of what Buffalo and Stony Brook do for the entire state. So this was a good start to that conversation and thinking about how we do a better job with that.
Yeah, that's great. Any other the other council members have any comments or questions for Pedro or Ken?
Kevin, I would just, people have been individually writing to me and asking for both Rosa's slides and Pedro and Ken's slides, and we will get them out to people. Pedro and Ken's have the caveat that they're not public, and we will get them out to you.
Great. Well, again, Ken and Pedro, this was very helpful. And to the council members, this was, we thought it would be good to get this information before you. It keeps all of us informed of higher education issues, not just at a local level, but at a national level. And we should be aware of what's happening, outside of our own little Long Island cocoon at Stony Brook. So very helpful and useful information. And Maury, I support any efforts that you may use with Ken and Pedro to help us with a New York-centric focus analysis in the future. All right. Well, again, thank you. So the next item on the agenda is new business. Does any council member have any other business they'd like to raise? Any other issues or? All right, not hearing any. Council members will be participating in a New York State mandatory sexual harassment training. It's 10:45, and I'm going to ask Rachel and Judy that starts at 11 a.m. So we could all take a little break before that training session. Maury, is there anything else that you'd like to raise?
No, I would just especially like to thank Ken and Pedro for coming and sharing that information with us this morning, but even more importantly, for the work that they continue to do for those of us who are leaders at America's public research universities or leading research universities, so that we can benefit from what they are helping us understand about the ways we talk about ourselves and the ways we share with the public the work that we are doing. And then I want to thank all the council members for being here this morning. It was good to see you again. I hope everybody has a safe and healthy holidays, which probably means you'll be relatively in your regular pods and not traveling too far. But I hope everybody stays healthy over the holidays. So thanks. Good to see you all.
Well, thanks, Maury. And unfortunately, Maury, you will miss because we're not having it. Every year in January, we have the best party in Albany the night before the State of the State address. And obviously, the Long Island Association and Bethpage Federal Credit Union with Linda, we've been doing this for 8 years now. And obviously, that is not happening. I suspect the governor's State of the State will be a virtual one. The presidential inauguration is going to be different and smaller and different than what we're used to. And I suspect our next meeting on February 8th, 2021 will also still be virtual. And so, count on that. And Rachel and Judy will get that information out to us at the end of January. So if no other issues or items, I also want to wish everybody a very happy holiday season, and we'll see you next year. I'm sorry, Judy, one last comment?
Yeah, just for those who are staying on for the training, you can just stay in this Zoom, take your break, put your cameras off, and then come back at 11. We'll just keep this open.
Okay, great. Happy holidays, everybody. And thanks again for these really super high level presentations. They were fantastic today. Thank you.
Thank you.
Thanks all. Bye-bye.
Thank you.